My favorite part about helping people to build families is seeing how someone that really feels like it's not going to happen for them and taking them through the steps to get them first pregnant and then seeing them deliver their baby. Just the happiness and the hope that I can give them really makes me feel fulfilled, and that's what I enjoy most. I grew up in the state of Iowa, was born in Oskaloosa, and did a lot of my training. Did residency, undergraduate, and also a PhD at the University of Iowa. The reason I chose REI is a little bit complicated. I'm really a scientist at heart. I've always wanted to be a scientist since I was little, but I also have wanted to be a doctor. And finishing medical school, I had my encounter with OBGYN and seeing families being born, literally. And then I realized that this was a perfect opportunity for me to tie those two things together. My approach to patient care is really direct, and I try to be as informative as possible. I like to talk about all the different options and really make sure that my patients are well informed. In my free time, I enjoy kind of taking things to the extreme. I like to experiment with things like electronics, made a remote control wagon for my daughter. So as a resident, I was actually voted as one of the most caring residents, just because I really followed up with my patients, called them, and took the time to talk to them, even if it meant that I had to stay a little bit longer. The advice that I would give to patients struggling with infertility is not to give up hope. There's always options that we can talk about, and there's always ways of getting to a family. Maybe not necessarily ways that patient has thought about, but those are the things I enjoy talking about, and helping patients to realize those things that they haven't yet thought about, and helping them get to that ultimate goal of having a child.